Hello all, my name is Jim McSwaney. I'm National Manager for Disposable Negative Pressure, and I've been asked to show some tips and tricks on applications of SNAP. So as you can see, we have our setup here. We have our demonstration leg, and we'll be doing a lateral aspect wound about the size of a quarter. We have our 10 by 10 dressing to my left, which is still, it's been taken out of the sterile packaging, but it's still in the box. We also have our blue foam, which comes with the 10 by 10, and you can see I've already taken the liberty to cut the foam to fit, just from a time savings. And then on my right, we have 125 millimeter cartridges, as well as just our boxes with our bridge dressing and our 15 by 15 dressings. So we're just going to take that foam that I've pre-cut and put it into the wound. I've already taken the liberty to use my secure ring and break a piece off. You'll notice that I've rolled it out in a long snake-like manner, just like when we were kids playing with Play-Doh. The reason I do this is twofold. Number one, it warms up the hydrocolloid, makes it stick better, but it also, for me, makes it a lot easier to work. So now I am going to make sure that my foam is in the wound, and I am also going to put my hydrocolloid around the wound edge, leaving approximately 1 centimeter away from the actual wound edges. Now, once my hydrocolloid is on the wound, what this does is it decreases the seal area I need with my 10 by 10 dressing, and you'll see that in a moment. So now I'm going to take my 10 by 10 dressing that's in the box. I'm just going to remove it from the box. I'm going to leave the quick connect valve in the box and just put that off to my left for the time being. Now, if you take a look at the 10 by 10 dressing, it comes with a 2-peel backing. The 2 peels are released by the blue pieces on the back. So there's a longer one and a shorter one, but that will open up. We always want to take our wounds with SNAP and work from the wound backwards. And what I mean by that is we want to focus in on the wound itself and then determine where the cartridge might be going. So generally this patient would wear their cartridge on their leg or up by their hip. So I want to make sure the tubing is going in that direction. So what I'm going to do here is, this is a very small wound. I am going to peel my blue backing just past the port in the middle. You'll notice that the port is exposed and I have the hydrocolloid exposed. Now notice that I'm doing this without gloves. The reason I'm teaching this trick is that with gloves, and it will be a clean procedure in your wound centers and most anywhere SNAP is applied, gloves will stick to this hydrocolloid. So if they get touched, you're going to have a problem. So we want to hold on to the 10 by 10 dressing. We want to put our thumb over the port and push down onto the blue foam. And then what I want to do is I just want to warm up and seal the area of the hydrocolloid that is exposed and does not have backing on it. So you'll notice I'll smooth up and down just on this one portion. I'll push in and around the foam onto the secure ring with my fingers. And I'm just warming up and getting this set. Now you'll notice that I still have the backing on the rest of the 10 by 10. And as I slide this off, I am going to smooth down as I go. So I'm just smoothing and peeling the dressing down as I go. Generally, this takes a little bit longer, but it will give you a much better seal because I'm warming it up. Now with the other side of the 10 by 10, you have a much smaller peeling that you need to take off, but we're going to do it the same way. So we're going to peel slowly, warm the hydrocolloid, smooth it down as we take this off. And as we pull the backing off, you'll notice that I'm just going left to right, right to left, and just getting it set. Now you'll notice that the hydrocolloid itself, there's a couple of wrinkles, there's a couple of bumps, but they're all outside the secure ring. So we do want to do a good job of making sure that the secure ring and that the 10 by 10 dressing are intact, that they're meeting each other, and that we want to roll out as many bumps and seals as possible. Now, by using my hands on a hydrocolloid, it's going to warm up the hydrocolloid, it's going to help to warm the secure ring, it's also going to feel good for the patient, but also it's going to make sure that this wound has a good, strong seal. Now, you will notice that there's one wrinkle, but this is outside the hydrocolloid, so I'm not as worried about this when I go to get my seal. Now, I reach over and I take out my quick connect valve. A couple of things I want to point out to your quick connect valve. First thing is that I am holding the quick connect valve in the middle. On top, we have a rubber diaphragm. This is a seal portion of our Quick Connect. So you'll notice that this little cap looks very similar to a lot of things that we see with nurses, with IVs and other things, and they're used to popping this off. We do not want to do that with snap because we will not get a seal. So we want to make sure that this rubber diaphragm is in place. We also want to hold the cartridge by the middle, the Quick Connect by the middle. This gives us not only a better handle, but we don't want to get any of those Quick Connect releases, and I'll come up to that in a second. I'm going to take my Quick Connect, I'm going to take my cut to fit tubing, and I'm actually going to place it into the Quick Connect and get a good connection. Now you'll notice that I have not cut the tubing. I prefer not to cut the tubing to the very end, and the reason is that I can approximate where the patient wants to wear it once we get a seal. And also, once we get a seal, I know that if I take the Quick Connect off and cut the tubing to fit, and now I have a leak, it's probably with my cut in the tubing and not in the sealing. So now I'm going to hold the Quick Connect. I am going to pick up my 125 millimeters of Merck cartridge. And if you notice, I'm holding the middle of the Quick Connect. I'm going to push this in, and you're going to listen for a click. I am now going to take my fingers and grab onto the release valve and take this out. Now, clinicians like to hold and apply snap by holding the quick releases and pushing it into the cartridge. I want you to get away from doing that. The reason is that there is a potential that when you slide this in, you'll notice you do not hear a click. And the reason is that the reason I want to get you away from this is there is a potential that by holding down on the sides of this and trying to seat it, that you could actually get a leak in and around this area and not know it. So you'll also have a much more difficult problem with trying to figure out where that leak lies if it is up in the seating area. So I want you to get used to holding on to the Quick Connect in the middle, push in, listen for the snap. No pun intended. Once you hear that click, you're going to take a look at the cartridge. We're going to press down on the cartridge to release the negative pressure, or apply the negative pressure. You're going to hear a little whistle. That's air being drawn out of the wound, and you'll notice that the cartridge comes up. Oftentimes, depending on the depth of the wound and how big the wound is, you may have to prime the cartridge a number of times to get the foam to remain flat. Now you'll notice so far so good. We have the foam pulled down. We're going to just push back down on the cartridge, and we're going to let it back up. Now you'll notice it's still sucking down, but it seems to have that we have a little bit of a leak. So what we will do is we will come back to our hydrocolloid, and we'll continue to work this wound edge and continue to smooth it out and make sure that we have all our bumps and areas of the seal out of the way and that everything is good. And then we're just going to push back down one more time, and that should do it. And we now have a snap application. At this point in time, if your patient wants a shorter tubing, you can absolutely disconnect this and cut the tubing and then reconnect. You'll just have to remember that you will have to reprime.